Suicide is a crisis. It is a crisis of faith in ourselves, our community, our ability to thrive as a person and as a society. If you have lived through the death of a loved one by suicide, you understand how deep this crisis sits. If you have faced the choice yourself, you have sat in the deepest of the pits. In the United States, currently, suicide is the 10th leading cause of death for all ages. In 2019, veteran death rates by suicide had increased from matching civilian rates to outstripping them at 1.5 times that rate, or twice that rate if they were a woman veteran. How does a republic, representative government of the people, develop policy to address a national crisis of death? Developing representative policy requires listening to those who know of what they speak. First, the president issued a mandate to mobilize the resources needed to assemble a task force and research team. The Veteran Affairs Office of Research and Development released a formal request for information, which is essentially a very large, open-ended survey to collect people's experiences about a topic. In this case, veteran suicide. More than 600 individuals and about 100 suicide prevention organizations answered the survey, resulting in more than 9,000 total question responses that had to be analyzed in less than 3 months to inform policy. So a team had to be brought in. 2 lead researchers based in the Salt Lake VA healthcare system stood out for their commitment to listening to veteran voices and research. One is a retired Air Force nurse and a survivor of traumatic brain injury who is committed to putting veteran voices at the heart of TBI research. The other, a practicing VA clinician and visionary methodological innovator who conceived a way to review qualitative data at speed and scale. They assembled a team that could analyze the survey responses through deep listening. We listened.
People don't walk around wearing pins saying they have suffered TBI and are struggling with depression. How often do loved ones find out after the fact? Military members are taught to shoulder their burden while maintaining posture and bearing. If I'm seeing the VA for physical injuries but a civilian doctor for mental illness, how does anyone know these determinants are piling up?
Veterans have been told they are sick or broken, whether it's diagnosed with PTSD, TBI, CTE, etc., and no one wants to be identified that way. When they have to engage with other people, they do their best to conceal their ailment as to avoid embarrassment, but find it much easier to not engage at all.
Stop blowing up stuff that doesn't have to be blown up. Giving them TBI. Give them better head protection.
Post-deployment TBI screening is limited. The technology used to screen for TBI does not capture all variables related to TBI. The physical changes related to TBI are minute at times. Insomnia, vertigo, and other TBI-related symptoms have to be noted and reported by soldiers.
Another gap area is in listening to the family members of soldiers because they often see what is really happening for the soldier. If a family member is concerned about their soldier, then somehow that should be taken into consideration instead of being ignored and only relying on the soldier alone.
The comorbidities of PTSD with TBI demonstrates a need for multiple disciplines for acute diagnosis and clinical treatment. Although symptoms are similar, treatment paths are not. A misdiagnosis could prescribe a treatment path that is less effective, ineffective, or potentially harmful physically. A misdiagnosis could potentially represent a failure to suppress risk factors of veteran suicide.
Treating veterans with chronic pain issues like criminals and expecting them to not have their pain adequately managed is a contributing factor to veteran suicide rates. An examination of medical records of veterans who have committed suicide show an underreported incidence of chronic pain either untreated or inadequately treated.
Stop focusing on who has committed suicide and seek new venues of research, like social media analysis or other things. Younger veterans are likely to engage in social media or internet platforms, so collecting data on platforms and activities online may provide information to how suicide risk increases or what veterans find helpful in their use of the internet.
Trusting the VA is still a major barrier, as is the quality of care received while there. Additionally, the veterans that need help are the ones that aren't out asking or looking for help. Each of the veterans that I know who committed suicide slowly and steadily downsized their social circles until it wasn't second nature to check on them anymore, so it will take work to stay on top of.
It's hard to determine why a man or woman committed suicide after the fact. Most of the time, they will be driven to the point of departure by disrespect and not being needed anymore. A person needs respect from their family first and the people they work with.
I imagine that the veteran who committed suicide in an outpatient clinic a few months ago wouldn't have felt that was his only option. If the patient advocate rep he was seeking assistance from after leaving the mental health clinic had shown him that someone in the system gave a shit. If you employ more people who actually do care about veterans, people who are veterans, better yet, combat veterans, maybe someone along the broken health system chain can stop and recognize someone in crisis because they have probably been there before themselves and actually intervene before they feel suicide is the only option.
There needs to be a team of individuals who are willing to help a veteran by simply making an in-person contact with them and their family. One veteran I know committed suicide. The problem for him? A lack of housing with dogs, inability to manage finances, self-medicating with alcohol, poor support system, inability to talk about the violence and ugliness of war, even when participating in VA-provided counseling, and the embedded suck-it-up mentality that is drilled into our brains. The pride that we all have in serving our country, and the shame we feel when we have to ask for help. Buried deep within our souls, we'd rather suck it up than admit we are weak. For those veterans whose family recognizes the deep-rooted changes, because we all are changed after deployment, need help with dealing with the struggles, how to deal with the sense of letting their loved one down for reaching out to get them help. Counseling to repair the brokenness of the family structure, and tools to know what to do and when to do it.
When someone you love experiences TBI, PTSD, or other mental health stress, it impacts the entire family, and research on family supports, education, and treatment is as important as the individual treatment. I'm a wife of a veteran who has PTSD and has been suicidal. It is our disorder, not just his.
Listening to these stories, and more like them, our team was able to identify themes that were similar to those found in other veteran suicide prevention work, and also identify new themes related to specific experiences people described. Individuals expressed that concerns and desires for help are not always recognized, communicated about, or appropriately acted upon by healthcare personnel or institutional representatives, especially for veterans with service-connected injuries or disabilities. Individuals also expressed the need for veterans to have broader connections in the greater community, not just with healthcare providers, and to have more healthcare providers who understand military experiences. Community organizations working to prevent veteran suicide recognized a need for more training for providers who don't have a military background, and a need to integrate military and veteran organizations better with these community services. VA research used the results of this study to develop the Prevents Roadmap and National Prevents Public Health Campaign in 2020. Since then, U.S. states and territories have been participating in governors' and mayors' challenges to prevent suicide among service members, veterans, and families. Businesses have partnered with the national campaign and state governments to conduct local suicide prevention events for veterans and anyone else living in the U.S. at risk for suicide. Many state governors have signed pledges of support for the national campaign and declared specific days of suicide recognition. What began as a federal effort for veterans has spread its wings to shelter all Americans. Veteran suicide is not a veteran problem. It is a human problem. We are all impacted. We are all affected. We all fall with the fallen. When we are not part of the solution, we are part of the problem. Listening to veteran voices gives us more chances to elevate those who have made sacrifices so we don't have to. What sacrifice is it for us to listen? It is not a sacrifice at all. Rather, it is a gift that now is making a great impact to support the lives of others.